Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
glad to be here.
A mission to
Delivery. Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to this episode of AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Tevin Wooten, and Tevin is a meteorologist for NBC Boston and formerly of the Weather Channel. Tevin, thank you so much for joining me today.
Robin, thanks for having me. I'm so excited.
Me too. And it's a unique topic that is related to public health in a unique way. But tell me about your connection to Arkansas and your love of meteorology.
Yeah, so my connection to Arkansas is I am from Arkansas. I was born and raised in Arkansas. I went to the University of Arkansas. My parents still reside in the state. My brother still lives in Arkansas. I try to come back every year, essentially, maybe even twice a year too. But I spent the better part of my formative years in Arkansas. My whole college experience started there. My first several jobs were also in the state too, from TV and radio and volunteer organizations. So being a part of Arkansas is who I am. From a weather, climate, and sort of health perspective, living in Arkansas for anyone, you are most certainly exposed to wildlife. You're exposed to the outdoors more than most. So I think in terms of how my love for the environment came to be, it was just simply being a part and being outdoors. I'm also an asthmatic, so the public health perspective from this and the climate connection is very important too, because I tell people it's difficult enough for me to breathe clean air, so it's almost more difficult for me to breathe polluted or dirty air. And I know that I'm not the only American going through this. I know that there are so many across the U.S. and across Arkansas living the same journey of having difficulty breathing polluted air.
And you recently worked with the Massachusetts Association of Public Health. Tell me a little bit about that and how this kind of transpired over into today's conversation.
Yeah, so the Massachusetts Association of Public Health Nurses is an organization here in the Commonwealth or here in Massachusetts, but I spoke to one of their chapters about the intersect of climate and public health. And as someone who sees, lives, breathes climate and weather every single day and natural disasters every single day, to me, it's a little bit more in my face. But to some of those nurses who have also been on the front lines, I mean, we just went through a global pandemic, but to those nurses who have been on the front line for decades, some of them longer than I've been alive, it wasn't as explicit. And so my job as a meteorologist and someone who understands climate more than the average person is to connect the dots. And that was about an hour-long session of connecting the dots between climate change, natural disasters that have been accelerated by climate change, and how public health nurses are sort of on the front lines to a lot of the response, not just from climate disasters, but each and every day for the people that they serve.
And how does that on a broader scale even affect the southern states? It's not just Arkansas, as you know, our audience is pretty broad, but how does that affect, would you say, public health in general from the work that you do?
Yeah, so when we think about public health, we think about the day-to-day response of how Arkansans specifically, or those across the Southeast, are living and breathing in their communities. And I think from a public health perspective in climate change, it's very important to look at sort of the regionality, because what happens in the Southeast is not what happens in the Northeast. In the Northeast, we deal with winter storms, several times throughout the course of a winter. In the Southeast, you may not deal with a winter storm perhaps once every 3, once every 4, once every 5 years. But in a changing climate, or because of climate change, some of the cooling, I know that we focus so largely on the warming that's happened globally, but there's also the extreme too of what happens on the opposite end of the spectrum. That fluctuation is because of climate change. So for the Southeast, that may look like, an extremely cold snap where all of a sudden infrastructure and buildings and communities that have not had to deal with temperatures at 0 or 2 below 0 in some instances, I believe happened in 2020 or 2021 in Texas and in Arkansas. These are more climate-fueled disasters that now nurses have to respond to specifically from a public health perspective that they may not have had to deal with before. So my job is, again, to connect some of those dots. In the Southeast, it's not just, cold snaps that are tipping the scale, but it's also vector-borne illnesses. Specifically, when we talk about climate change and how the earth has warmed, that warmer air holds more moisture. That more moisture could lead to more flooding, which could then ultimately change the migration pattern of some mosquitoes that carry illnesses and viruses with them that may have been confined to the equator or other areas globally in the country that are now pushing into the Southeast specifically. I mean, you have perhaps been to Florida, and some of your viewers have been to Florida too. There are things that, specifically were at one point were right along the Gulf Coast that we're starting to see migrate into the Mississippi River. That also impacts our eating patterns too. Deer, a very popular game there in the natural state, are now carrying viruses that traditionally they didn't carry before. At the very least, they were a bit more contained. So all those migratory patterns have sort of been influxed, if you will, or induced by climate change.
And who would you, from your work, who are you seeing is at risk, even a greater risk, say in the next 5 years or so? What areas are you seeing that, and how climate change would affect health?
Yeah, so I liken this to Animal Farm. All people are created equal, but some are more equal than others. All populations are vulnerable to climate change, but some are more vulnerable than others. Specifically, when it comes to Black Americans or African Americans, people of color here in the United States, and also people of low socioeconomic status. And it's not because they are, just born into this world that all of a sudden, they are immediately sort of at the front line or closer to the footprint or fingerprint rather of climate change. But if you think about where a majority of African Americans live, or a majority of where people of low socioeconomic status live, it's oftentimes near highways or in housing authorities that were put on cheaper land that are near highways. So you have a lot more car traffic now that leads to higher rates of air pollution in some of these specific sectors or neighborhoods. So that's sort of how there's a direct impact, but also the indirect of when you are of low socioeconomic status, you may not have the financial means to go to the doctor to now deal with these side effects of climate change, or you may not have the time off from work. I know that we look at that as a luxury, and it truly is, unfortunately, a luxury for a lot of folks to have the adequate time off to go deal with health impacts if they do have insurance, if they do have the financial means. So there's sort of a compounding or a multi-layer issue when it comes to the response to climate change and also the response to health and climate.
And why do you think that there's a focus on climate change and health and how they correlate together now?
I think there's a larger focus. Let's just go back to 2020. I think that's the most recent example when all of us were forced to be in front of our TV screens a lot more, forced to be in front of our cell phones a lot more. So we were seeing things as they were happening in real time. And I think as a nation as a whole, we looked at this and we said, wait a minute, this is actually happening in our day to day. And so people are starting to ask more questions, but not just 2020, but even before then, a lot of these natural disasters have been climate induced or climate accelerated, be it cold snaps, be it winter storms, be it even flooding events and also hurricanes too, or even heat waves, which I'm sure you've heard the example before that, back in my day, we would have to walk to school both ways in the cold or in the heat or whatever that excuse may be, or whatever that the scenario or the example may be. But now we're tipping the scale. The thresholds are much higher or much lower, depending on, if we're talking about extreme heat or extreme cold. So it's not fair enough to say that, to equate the apples and oranges to back in my day when it was 85 and sunny, we had to walk to school. Well, now it's not 85 and sunny. Now it's 93 and sunny. Oh, and by the way, some of these schools are a little bit farther away from population centers now. Or if they are in population centers, these students are having to walk through areas that contain more, or students are having to walk through areas that contain more air pollution. So it's a multi-stacked or multi-level issue that, getting down to the root cause, it has to be something that each and every American considers in their day to day. And for nurses too, since we're speaking to sort of that sector, I think you also have to now ask questions that you may have not had to ask before. Going back to the group of nurses that I spoke to here in Massachusetts a couple of weeks ago, one of the nurses said, when I started in nursing 25 or 30 years ago, I may have had 7% of my students, of about 1,300 students, I think this nurse said, 7% of her students may have had asthma. But then by the end of her tenure, that looked like 25 or 35% of the students. And it's not just because, let's face it, yes, the air pollution has gotten worse, but we're also learning to screen for things and to ask questions on well, where exactly do you live in your community? Do you live somewhere that's near a highway? Do you live somewhere that doesn't perhaps have adequate parks or adequate means for having cleaner air? Do you live in a housing authority that doesn't have proper ventilation? So yeah, that's sort of how it gets to the root cause, I believe, of why this is now starting to be a bit more concern for Americans.
And are there federal efforts being made to address climate change and health equity? Are you seeing that on a large scale?
I am. And, some of this goes back to politics, and I hate playing politics with science. I don't think this is something that should be politicized. We are dealing with every American, and we're dealing with the health of everyday Americans too. So we have to lean on the science. We have to lean on the nurses. But ultimately, the only way that you get to influence change is through policy. And so federally, speaking to this specific administration, they just announced the American Climate Corps, which rallies together a group of about 20,000 Americans, specifically younger Americans, to train for higher demand, clean energy jobs that we know that will be able to take, Americans to the next step at reducing our global emissions. And speaking of reducing our greenhouse gas emissions globally, the Paris Climate Agreement was, I believe it was signed by 194 nations or parties rather in 2016. And that is to limit our greenhouse gas emissions globally, right? And that's to reduce the global emissions, but also reduce our temperature to pre-industrial levels globally. We're trying to limit warming in the U.S. to about 1.5 degrees Celsius to 2 degrees Celsius, somewhere in that threshold or lower would be great. But what we do is our part, but we have to do this nationwide or globally, because that's the only way we're really going to provide a substantial boost. And we have to do it rather quickly. And that's why it requires federal action, like what we see from the Biden-Harris administration and for other parties across the world. Because as much as we can do a little, we all have to take part in this.
Well, Tevin, thank you so much for sharing this information. It's unique in a way that I had never thought of the connection before, especially and on a broader scale that's not just about Arkansas. And I appreciate the information. Thank you.
Yeah, and I just want to add too, I know that we talked about some of the vector-borne illnesses and how heat can impact, but I want to go back to a group that I think everyone can relate to, expectant mothers. Mothers are the driving force for what keeps our population going. Specifically in the United States, for every 10-degree increase in temperature, in the state of California at the very least, there's an average in preterm delivery of about 8.6%. For mothers as a whole. But for Black mothers, that number almost doubles to about 15%. So we have to look at different ways to limit warming, but also look at different sectors, right? Because this is not a one-size-fits-all solution. Speaking to expectant mothers may look differently than speaking to those that are, dealing with agriculture every single day in Arkansas, which would be different than how we speak to emergency managers or nurses in Arkansas, or nurses in the Northeast, or those that are trying to prepare the Gulf Coast or the Atlantic Coast for hurricanes. So in order to really get a meaningful solution, we have to remember there are multiple solutions.
Well, thank you. And again, I'm appreciative of the time that you've given us and the knowledge. It's so interesting, and I'm appreciative of the work that you do every day. Even though you're far away in Boston, we still are glad to call you an Arkansan.
Every day I remind the Bostonians here that I'm from Arkansas, the natural state.
Well, I appreciate you, Tevin. Have a great afternoon. Thanks so much for joining us.
Thank you.
And that's it for this edition of AFMC TV. I'm Robin Ledbetter. Have a great day.